Why do some surgeons not believe in performing anterior platysmaplasties and just pull the platysma laterally, posterior? I'm very confused by the different answers given by surgeons regarding treatment of the face. Some say it's best to just treat loose platysma by making incisions behind the ears and pulling laterally. To me, this seems that it would just pull the bands further apart at the front of the neck. But stitching together the platysma at the front, corset style, seems quite unnatural. To do both seems like the pull is in two different directions and wouldn't hold. Also, some say to cut the bands. Why?
Thank you for your question. You are asking a very good question about why there are so many conflicting opinions on surgeons' preferences on how to treat platysmal bands. And you go through basically the laundry list of the typical approaches from anterior platysmaplasty, corset platysmaplasty, back cuts, pulling of the platysma. You're wondering, why is there such a variation? Well, when you get down to it, whether it's facelifting, neck lifting, and all of the different aspects of these procedures, there is no perfect solution. And that is why there are varying opinions. I think as a specialist, and a little bit of background, I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial plastic surgeon, and practice over 20 years, and I offer the full range of face and neck lifting solutions in my practice. And I have done all those procedures. Because one of the greatest frustrations for surgeons is that if someone looks great after surgery and you're really happy, and then a year later they have recurrent platysmal bands, you wonder, how could that possibly have happened given whatever technique you were doing, you worked so hard to do. The reality is that platysmal bands will sometimes respond very well to different methods, and so every surgeon feels like whatever they're doing has probably worked out well for them in terms of the consistency and predictability. But I can tell you, been being in practice for this long and seeing a lot of my senior surgeons change their approaches, where they were so passionate, so dogmatic about the very best way to treat these bands, only to 5 years later say they've evolved to something else. There is constant evolution in what we do, and I would say that in the modern approach to facelifting, neck lifting surgery in my practice, where our goal is to do these procedures with the quickest recovery, with the lowest risk, and the highest level of predictability, I think that my approach is reflective of what is the needs of the modern patient. And what I mean by that is that sometimes it takes a dual approach. Sometimes you have to do not only the surgery, but also address volume correction, skin quality, treat the platysmal bands maybe with neurotoxin like Botox. Essentially, we need to do everything we can to maximize the outcomes, but certainly facelifting, neck lifting surgery is still very, very successful at dealing with a lot of these issues. But the reason why a lot of you're dealing with these conflicting opinions is that every surgeon comes to their procedure with a different perspective. In my opinion, when the way I approach these issues, because I do all those procedures, I look at the platysma, I look under the neck, and I make a decision as to whether or not I think that the platysmaplasty will be successful, whether back cut, release, and lateral pull of the platysma would be successful. I make a lot of decisions based on what I see intraoperatively. A lot of times doctors like to promote certain techniques as being the best way to do something, and that's how they differentiate themselves. But I would state that a majority, I would say, of my colleagues who have experience and who are honest about what they do will say that they don't do everything the same way, but do things as per what they see during surgery. There can be a plan, but that plan has to be still flexible. So I think you have to just talk to your doctor, find the surgeon that you feel comfortable with, and get a realistic understanding of what to expect. You know, if there was one best way to do something, we'd all be doing it exactly the same way. So it really is about what we can expect, and then what can we do if there's a need for an enhancement, whether if there's a need for something else to further augment and maximize the results. This is where we are very fortunate in the time we live in that we can offer so many additional procedures that are less invasive that can complement and enhance and maximize the results for our patients. So I hope that was helpful. I wish you the best of luck. Thank you for your question.